Well, I apologize for the disorganized presentation that I have for you here. Many of these slides I prepared back in March when the transition was made from classroom teaching and laboratory teaching to online instruction, and I didn't know a whole lot about how to do any of that. So I threw some of these PowerPoints together without really knowing how to do much of it. So it may be a bit disorganized. What I would recommend that you do is make sure you click on the slideshow icon down at the bottom right, and then each time you click, something different will come up. You may have to click on the play button to get the audio to play. In most cases, the audio will play if you just click again. So you will learn how to navigate your way through these, and hopefully the disorganization will not uh, trouble you too much. So go ahead and get started. There are a lot of muscles here and a lot of information for you to learn. That's the nature of this course. So good luck. Okay, if you made your first click, then you should see the image and you should see the lines pointing to the various structures. I would hope that you would recognize there the mastoid process of the temporal bone, the external acoustic meatus, and just inside that, the styloid process of the temporal bone. So we'll start there on the right, the top line on the right. If you would like to click on it, you can. You can see that is the posterior belly of the digastric muscle. Remember, the digastric actually extends from the chin and then makes an upward turn toward the mastoid process. So we have an anterior belly and a posterior belly of the digastric. This posterior belly has been cut off so that you can see the other muscles that are deep to it. Obviously here we have origin of the chin or the mental protuberance, insertion at the mastoid process. The innervation of the posterior belly of the digastric is cranial nerve number 7, the facial nerve. Click again. You should have the name of the second muscle that comes up there, the stylohyoid. Well, as the name suggests, we're going from the styloid process of the temporal bone to the hyoid bone. Our innervation there also cranial nerve number 7, the facial nerve. Click again, and what you see is a muscle that runs from the styloid process to the base of the tongue. So that is the styloglossus muscle. These are muscles that move the tongue within the mouth, called extrinsic muscles because they are exterior to the tongue. The muscles that are inside the tongue are called the intrinsic muscles of the tongue. So this is an extrinsic muscle of the tongue, the styloglossus. The innervation here is cranial nerve number 12, the hypoglossal nerve. Okay, click again. The muscle that we have here is the middle pharyngeal constrictor. There are actually 3 of these. The superior pharyngeal constrictor has been cut off. It's up there by the stylohyoid. All 3 of these are innervated by cranial nerves 9, the glossopharyngeal, and cranial nerve 10, the vagus nerve. These are muscles of deglutition, initiating the act of moving the bolus or chunk of food into the esophagus. Click again. That brings up the inferior pharyngeal constrictor, which I have already talked about. Click again. That brings up the esophagus. Click again. That is just to show you the trachea. Click again. That is the thyroid cartilage of the larynx that is being pointed to. So our next muscle there, if you click one more time, we come to the hyoglossus. Obviously, from the name, the muscle is extending from the hyoid bone to the tongue. It is an extrinsic muscle of the tongue, moving the tongue in the mouth for the purposes of chewing, swallowing, and also vocalizing. The hyoglossus is innervated by cranial nerve number 12, the hypoglossal nerve. Click again. There, just above the bone, is the floor of the mouth itself. That muscle that is there is the mylohyoid muscle. It extends from side to side all the way across the floor of the mouth. The innervation there is the mylohyoid nerve. Click again. That brings you to the geniohyoid. Genio is a UCA word for chin. Since the muscle extends from the chin to the hyoid bone, then that's where we get the name geniohyoid. Click again. That brings us to the genioglossus. The name indicates that we are going from the chin to the tongue. The geniohyoid and the genioglossus also are innervated by cranial nerve number 12, the hypoglossal nerve. All right, one more click and that brings us to the palatoglossus. You can see how that muscle curves down from the palate along the lateral walls of the throat and then inserts under the undersurface of the tongue. The innervation of the palatoglossus is cranial nerve 10, the vagus nerve, and cranial nerve 11, the spinal accessory nerve. So those are the extrinsic muscles of the tongue and also the muscles of some of the muscles of deglutition. There are actually 22 muscles involved in the act of swallowing. Many of those are the intrinsic muscles of the tongue, and we will not cover those. All right, that will do it for this show. Have a good day, have a good evening, have a good night. See you next time. Okay, if you have the image up, then all you have to do is click one time to show the lines. See if you can identify the superficial muscles of the back. If you want to go along, they will go in a clockwise direction here. Click once. That is the big diamond-shaped elevator of the scapula and arms. The trapezius, the innervation there is cranial nerve number 11, the spinal accessory nerve. Over to the right, click, and you should bring up the deltoideus. That is the abductor of the arm, inserting at the deltoid tuberosity of the humerus, originating on the scapula. The innervation of the deltoideus is one of the branches of the brachial plexus. I can't remember which. Click again. Down from there, you have the infraspinatus sitting in the infraspinous fossa of the scapula. Click again. There is your teres minor, another rotator cuff muscle. And just below that, click again. There is your teres major. It is not a rotator cuff muscle. And then we have the big doo-wop-a-daddy, the latissimus dorsi, originating on the spinous processes of the vertebrae, also originating on the iliac crest, inserting on the surgical neck of the humerus. Next slide. With the trapezius and the latissimus dorsi taken out of the way, we can see the deeper muscles of the back here going up to the neck area there, actually inserting on the occipital bone of the cranium. That is the splenius capitis. Click until you see the label, splenius capitis. There is also a splenius cervicis, which inserts on the cervical vertebrae, running right alongside the splenius capitis, but not shown here. Click again and you will see the rhomboideus minor. Again, the rule is minor over major. These are adductors of the scapulae. They draw the scapula toward the midline, as you can see. So click until you get to rhomboideus minor, and also rhomboideus major. The innervation of these muscles are from the dorsal rami of the spinal nerves. I will show you what dorsal rami of spinal nerves are when we get to the neurology section. Deep to the rhomboideus minor and major, we would see the serratus posterior superior. It is not shown in this image because the rhomboids are still there. But if we remove the rhomboids, there would be a serratus posterior superior there. Moving down, click again, we have 3 on the right side and 3 on the left side coming down from the neck and occipital bone. The medialmost layer of muscle there, the spinalis thoracis. When it's in the neck, it is called the spinalis cervicis. Same muscle, just in a different neighborhood. So look at spinalis thoracis. Lateral to that, you have longissimus thoracis. Lateral to that, you have the iliocostalis. Iliocostalis is simply referencing the origin and insertion. The origin is the ilium, and the insertion are the ribs. Now notice on the left side, you have the same arrangement. Those 3 muscles run parallel to each other along the vertebral column, left and right. They will come together to form one body of muscles that we call the erector spinae. South of that, we have the serratus posterior inferior. Over on the left side, you can see the external abdominal oblique. Between the ribs, we have the external intercostals. And then external to the ribs, the serratus anterior. Okay, take a few minutes here to get yourself oriented. Those are the spinous processes of the vertebrae pointing out at you there. Going left and right, those are the transverse processes. These are the deepest muscles of the back, and their contraction results in the movement of one vertebra relative to another. Oftentimes, they are all called rotatories. There are specific muscles labeled there called rotatories, but oftentimes all of these together are just simply called the rotatories. So between the transverse processes, you have the intertransversarii. Between the spinous processes, you have the interspinales. The multifidus is attaching the spinous process of one to the transverse process of another vertebrae. So contraction of these muscles results in the movement of one vertebra relative to another. Well, you should recognize lumbar vertebrae number 5. You should recognize the sacrum with the posterior sacral foramina, the median sacral crest, the sacral hiatus, and the 4 bones of the coccyx. Also, the iliac crest situated there. So we're looking at the musculature of the buttocks. The big guy there is the gluteus maximus. Deep to that and extending up along the side of the pelvic bone is the gluteus medius. And deep to the gluteus medius, we would have the gluteus minimus, which is shown on the other side. Innervation of the gluteus maximus is by way of the inferior gluteal nerve. Innervation of the gluteus medius and the gluteus minimus is by way of the superior gluteal nerve. Moving around to the left side of this particular diagram, where the gluteus maximus has been removed to expose the lateral rotators. Well, I like to remember things in a particular sequence, so I always go from the top down. So in the muscles that are called lateral rotators, which turn the feet outward. In fact, turn the entire leg outward. So that is a lateral rotation. So the first muscle of the lateral rotators is the piriformis. I always recognize the piriformis because it sits just above the exit of the sciatic nerve. So actually, between the piriformis and the gemellus superior, you would see the large sciatic nerve jutting out through that little opening there. So muscle number 2, gemellus superior. Muscle number 3, obturator internus. There is also an obturator externus. However, it is not shown here, and in fact, it is not seen from the back side. You would have to look from the front side in order to see the obturator externus. The other two muscles of the lateral rotator group are the gemellus inferior and the quadratus femoris. So these are the muscles of the buttocks. By the way, the innervation of the lateral rotators is by way of mostly the sacral plexus. The obturator internus, oddly enough, is innervated by branches of the lumbar plexus. So lumbar and sacral plexus nerves innervate the lateral rotators. Well, welcome back to the UCA Online Anatomy and Physiology Lab. Here we are looking at muscles of the chest and abdomen. This is a beautiful picture here for you. You should recognize a few things up north there. The trapezius muscle, innervated by cranial nerve number 11. You see the two heads of the sternocleidomastoid, also innervated by cranial nerve number 11, the spinal accessory nerve. In between those two, you have the little triangle, which includes the scalenes, which are accessory muscles of respiration. There in the anterior aspect of the lower neck, the infrahyoid group of muscles, I can see the sternothyroid, the medial most of those. I also see the sternohyoid, and I also see the superior belly of the omohyoid. I hope that you can see them also. On the left side, much of those are, at least the sternocleidomastoid and the inferior hyoid group, are covered up by the more superficial platysma. So that's a little review for you. Moving on down, we have the muscles of the anterior chest wall, the large pectoralis major. This is the principal adductor of the arm. It pulls the arm toward the midline. It is innervated by the medial and lateral pectoral nerves. When it is taken out of the way, we can see the underlying pectoralis minor. The pectoralis minor originates on the ribs and inserts on the scapula. When it contracts, it pulls the scapulae forward or around the side in such a way. Between the ribs, those are the external intercostal muscles. They are innervated by the intercostal nerves. Also, you can see there labeled a little bit of the subclavius. That is the muscle that runs just south of the clavicle, and also shown there the insertion of the subscapularis. Remember that the subscapularis is one of the rotator cuff muscles, inserting there at the head of the humerus. Okay, those are the external muscles. We will look inside and see what we have there on the next slide. Well, here we are inside the chest. If your head were inside the chest and you were facing forward, such as where the heart sits, if you're looking straight ahead, these are the muscles that you would see inside the chest wall. Between the ribs, those are the internal and the innermost intercostal muscles. They are innervated by the intercostal nerves. They are also accessory muscles of respiration. They will contract to enlarge the chest cavity to assist in deep breathing when necessary. Coming off the sternum and inserting on the ribs, the transversus thoracis muscles, also innervated by the intercostal nerves, also accessory muscles of respiration. So that's what it looks like if your face is where the heart is sitting and you're looking forward. Moving south from the thoracic cavity into the abdominal cavity, imagine that your head is inside of the abdomen and you're looking straight up. Well, this is what you would see. The muscle is dome-shaped, arched upward. That is the diaphragm. The diaphragm is innervated by the phrenic nerves. They are branches from the cervical plexus. Contraction of the diaphragm brings the dome down, therefore enlarging the capacity of the chest cavity. That results in inspiration or breathing in. Some of the landmarks that you should recognize there are the xiphoid process. That is not spelled correctly. The Z should be an X. UCA students would know that. Also, the passage of the inferior vena cava through the diaphragm, the passage of the esophagus at the esophageal hiatus. South of the esophageal hiatus, that tube simply becomes the stomach. Just posterior to that, you can see the aortic hiatus, where the aorta passes through the diaphragm. Descending left and right down into the posterior abdominal wall, these are the big ham hock muscles of the lower back, the quadratus lumborum, and also the psoas major. Here we have a good look at the muscles of the anterior abdominal wall. This is the rectus abdominis, extending from the sternum and the ribs down to the pubic bone. So we have four separate units there. They're separated from each other by collagen fibers called the tendinous intersections. The right rectus abdominis is separated from the left rectus abdominis by the white line, the linea alba. Also, we have the external oblique muscle, the internal oblique muscle, and inside of all of that, the transversus abdominis muscle. All of these muscles of the abdominal wall are innervated by the anterior rami of spinal nerves. Alas, arriving in the abdominopelvic cavity, looking posteriorly, we can see the large ham hock muscle of the lower back, the quadratus lumborum. Contraction of the quadratus lumborum extends and also flexes the lower back relative to the hips. Innervation of the quadratus lumborum is by way of the lumbar spinal nerves. Anterior to the quadratus lumborum, you can see the large psoas major and the smaller psoas minor. These two also are innervated by the lumbar spinal nerves. Notice that the psoas major will combine with the iliacus and insert on the upper part of the femur. So the action here would be to flex the femur relative to the hips. The iliacus is located in the iliac fossa and is innervated by the femoral nerve.